Hello. 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 Yeah, are you hearing, ma'am? Yes, ma'am. Okay. Hello. Hello.
Madam, we can hear you.
You are hearing now, sir?
Yes, madam, we can hear you.
Okay.
I hope you can also see the slides.
Yes.
Okay, perfect.
Okay. Can start now, sir?
Yes, madam, we can start now. Yeah.
Okay.
Okay, so welcome everyone. Thank you for joining in. We'll have, a basic awareness campaign for AIDS today. Today is the World's AIDS Day. So this session is for all of you to just create a basic awareness. And I hope this session will be useful. So with us is Dr. Harinakshi ma'am. She is a senior professor and teacher in nursing. She'll be talking about AIDS today. Okay, so madam, welcome. Thank you so much for being with us here today. I hope the session is useful for our students. So yes, madam, you can continue and just let me know when you want me to change the slides. I'll change the slides. Madam, we can't hear you. Yes, now your voice is audible. Please continue. Yes,
okay, sir.
Yes. Your voice is breaking. Students can keep the videos off so that there is no issue with the bandwidth. And during the question answer time, you can switch on the videos later on. Okay. To all the students, please keep your videos off. You can on it once during the Q&A time. Okay. To all the students, again, I'll repeat, please keep your videos off. You can on it during the Q&A time. Madam, you can start, madam. Thank you.
Okay, sir. First of all, I would ask sorry for the delay.
That's
everyone.
No problem. Yeah, that's okay.
Because of this is technical problem. I think because of internet, the server is down, sir, here.
Okay.
Okay, everybody, the immunity. First of all, the whatever other assets we are safeguarding, like that we have to safeguard our immunity also. Immunity is the greatest asset. Immunity is the greatest asset for us. We have to safeguard it. So this AIDS or HIV mainly affects the immunity, our immunity power. If once immunity we lost, everything is, that means we are losing everything, because all other opportunistic diseases will be acquiring our body because of less resisting power. So today is the, are you audible, sir?
Yes, madam. Yes, madam. Please continue, madam.
Okay. Today is the December 1st. That is the World Health AIDS Day. From 1988, the World AIDS Day will be started to create the awareness, and also those who are died due to this AIDS for mourning, and also we have to prevent by creating the awareness in the community and the whole people in the world. So today's theme is the equality. What do you mean by equality? Equality, that is for the peoples and also those who are providing the services from the lower ranker to upper rankers, and also for the easy accessibility of the services. All the benefits, whatever the benefits is available, what are the programs will be available in the government, it should reach each and every human being in the community regarding it might be the preventive aspects or the curative aspects, are maintaining the same status of the health of those who are suffering from HIV and this thing. And HIV AIDS refers to, this is the, as I said, acquired immunodeficiency syndrome. It mainly affects our greatest property, that is the immunity. Once immunity lost, everything we are losing, means all other organisms, microorganisms, pathogens are acquiring our body and predisposing and disposing many this one, what signs and symptoms, clinical manifestations of the opportunistic diseases. It may be meningitis or tuberculosis mainly, and the fungal infections mainly to the mouth, that is mouth ulcers, and also the skin lesions and diarrhea and fever. All other opportunistic diseases will be affecting due to the immune system affection. Okay, so the virus, as you all know, the virus is human immunodeficiency virus. This is mainly the RNA virus. This condition progressively reduces the effectiveness of the, as I said, effectiveness of the immune system. And what is HIV? It's a human immunodeficiency virus. This is the main cause for this virus is main cause for the this one, what, AIDS. The final stage of the HIV is called AIDS, and the virus does not live in toilets or mosquitoes, cups. It is mainly it lives in the human body. That's why it is human immuno virus we called. Okay.
Madam, you want me to change the slides? You let me know so that I can change the slide. We are on the first slide right now.
Next slide, please, sir. Next slide, please.
Okay, madam. Yeah. So I'm on the next slide. HIV virus.
This is, as I said, HIV. Next slide. Next slide.
Yeah.
This also, next. And definitions, everybody knows that. Definitions of and meanings. This is, as I said, is the human immunodeficiency virus, and mainly it breaks down our immune system, and if it affects the whole systems of the other systems of the body. Next slide, sir. And what is AIDS? AIDS means acquired immunodeficiency syndrome. Acquire means get or develop over a period of time. The immune system breaks down gradually over time. It gets deficient or less and less efficient under relentless attack by the multiplying number of viruses in the body. The syndrome, as you all know, the syndrome is a group of symptoms. It's not only one symptom. It's a group. Syndrome means group of symptoms, and there will be a group of symptoms. And once HIV we tested, it comes positive, means the person will be living another 25 years or 30 years. We are having many patients here. They are coming for the ART, antiretroviral therapy. And the final stage, once they reach this ART is only for the postponing their death. Postponing the death is not curable disease, and we can maintain the CD4 counts normal to maintain the immunity power for by preventing other opportunistic or associated diseases. So once the HIV reaches the final stage, that is called AIDS. This is the HIV. So next slide, please. This is the virus. The virus, as you all know, the virus is spherical in shape and double-stranded. Double-stranded, this one, what virus. and it's the multiplication of this virus will be very fast in the body. So this is the typical virus. This is the RNA virus. Next slide. Next slide. And epidemiology. Coming to the epidemiology, it's more than males, more the females, more than males, occurs in all ages and ethnic groups. That's why we from the adolescent period and the sexually active age, that is the from the adolescent to near above 60, nearly 64, 65, we have to do the screening. For any other screening we are doing, no, for pregnancy, especially all the screening, including this HIV also we are doing like that. For all the people, sexually active persons, we have to do the HIV screening to rule out.
Madam, your voice is not audible.
Hello, now sir?
Yes, madam, now it is fine.
Okay. Now the AIDS is now, it's a second leading cause of death in between 25 to 44 years. That age is, they will be very active in the sexual activity. So this is the second second leading cause for the death. That is 25 to 44 years. Then HIV transmission. This is very, very important. This is mainly through the unsafe sex. As you all know, this is hepatitis B, hepatitis C, and hepatitis B associated with hepatitis D. These all the diseases, and HIV also, all the diseases are mainly through the unsafe sex. It could be the heterogeneous or homosexual. Hetero or homosexual. So unsafe sex and using multiple partners. So we have to think the partner is the HIV positive. Then only we can be prevented by the HIV positive. So unsafe sex means without using condom. If the person is having the sex with the multiple partners, definitely there will be chances of getting the this HIV transmission. And if these all the minor, the major root of this transmission is HIV transmission is through the unsafe sex, and other minor, very minor possibilities are the cut wounds and breaks in the skin and mucous membranes are a direct injection. That is by using unsterilized, it could be, that is called iatrogenic, the way, that is the properly not sterilizing. And it should be properly sterilized, and single use of the syringes, we may prevent many diseases. These are all the roots of transmissions. That is, sexual contact is the main thing, and blood exposure. Blood, without testing the blood, if we transfuse the blood to any patients or any persons, there will be chances of getting it. And the perinatal transmission from the mother to baby. If the mother is having HIV positive, there will be chances of for the baby. For that, we are giving some medicine. The one medicine, the ART mother is getting, if she finds diagnosed in the first trimester, she should continue till her last breath. And also for the baby, as soon as the baby born, we are giving, for the baby is 2.5 kg. we are giving nevirapine 1.5 ml for the baby to prevent, to avoid this transmission from the mother to baby. And this one, breastfeeding also, we are not encouraging. Through the milk also, it may be chances of transferring. And routes of transmission, that is male to male, you all know all these things. Then male to female and vice versa, and female to female, that is homosexual and even heterosexual. These all should be a safe sex. If at all they want to use multi-partners, that is not recommendable. If at all they are using multi-partners, they should use condom without fail. Next. So next, the most common, next slide. The most common methods of transmission of HIV are, as I said, unprotected sex with an infected partner. Even unprotected sex with and not infected person also, it's not recommendable. We have to, the person, we have to advise the community with the, we should treat, there is one sentence, we should treat all the patients as HIV positive. Like that, we have to think, the community, the people should think that all the peoples, all the sex partners are HIV positive. Then only we are in safer side. Then sharing needles with infected person. As I said, this is we should use single syringe. When I was doing my course, basic course, nursing course, 88, that is 86 to 90, I have finished my diploma. Then I finished all my this thing in service education. That time, this AIDS was very, very this one, what in severity was there. That time we used to boil the glass syringes and we used to use it. At the end of my course, enormous change there will be. Then the disposable, everything disposable has come, and single needle for the single person, single prick. So sharing needles with infected person, that is also one of the major this thing, and almost eliminated as a risk factors for HIV transmission are from infected mother to fetus, as I said. Then infection from blood products. That's why we have to check the blood for before transmission for HBsAg and for VD or that is venereal diseases, any this sexual transmitted diseases the person is having, and also HBsAg, HCV. For all these diseases, we have to check the blood before transfusion. This is also one of the major this thing cause for the transmission of the HIV. Then the common body fluids. The common body fluids, next slide please. The common body fluids that are means of transmission is blood and semen, vaginal secretions and breast milk. As I said, the breast milk also, if the mother is having HIV positive, we will avoid the breastfeeding. And these are the body fluids. There are chances from one person to another. Next. This is the body fluids, HIV in body fluids. See, the blood is the major this thing, then semen, then vaginal fluid, then amniotic fluid also, then saliva. See, saliva is very less percentage. From the saliva, it transmits very less percentage, and blood is the major part of it, even semen also. Then the vaginal fluid, that is also an average, and amniotic fluid also little less chances of transmission. Next. This is this one, HIV infected T cells. That is the HIV virus that causes mainly affect the T cells of the T cells. You know, the T lymphocytes are very, very important to maintain or upkeep or to safeguard our immunity. So it will be affected. Then the HIV, this virus, this AIDS virus mainly affect the T cells. Then there will be changes. Automatically the AIDS will be. Then window period. See, this window period is very important. As soon as this HIV enters our body, immediately it not harbors any signs and symptoms of AIDS or HIV positiveness. And as a student, nursing, this thing, health workers, we have to look into if there is any needle stick injuries. Needle stick injuries, immediately we have to wash our hands. We should not squeeze any this one injured area with the needle. We have to wash with plain water. Then we have to report it immediately. We are here in government setup. We are maintaining one register, needle prick injury register. That is most of our paramedical students and even A&M students and even nursing students from you all also. You people are getting injured. We are maintaining one register. Immediately should be a notice to the doctor. It should be washed with plain water, and then we are referring you people to the students to the ART or any person, any health workers to the ART, and they will register there immediately. The needle pricked person, that is the patient. We are drawing the blood and we are sending it for the this one test, any HIV or HBsAg or like that, and we will observe the student or any other health workers for their window period. Then after the window period, again we will test the blood for that injured person for the HIV or HBsAg or HCV. Next. Then signs and symptoms, as you all know, this is mainly affecting the immunity system of our body. The immunity system, as I said, this is very good asset for us. Very good. Sir, are you hearing?
Yes, madam.
Okay. The immunity is the very good asset, very good property for everyone. We have to safeguard. We are safeguarding our mobile, cell phone. We are safeguarding our jewels. We are safeguarding our silk sarees and other costliest things. But we are not concerned with our very good asset, very good property. That is the immunity power. We are forgetting it. This is repeatedly I am telling, our health is a main asset, main property. So our immunity power is main this thing for the maintenance of our positive health. So we should be prevention is better than cure. So we should be we should have very much knowledge about the signs and symptoms. Then only we can treat the client, or we will take care of ourselves also. So this is the signs and symptoms. These all the mainly it affects the immunity system. Means there will be all other microorganisms. Say, for example, in our country, the military force. For example, I'm telling military force is weak, means all other border countries or China, it may be, or other enemy countries will attack our country. Is it so? So like that, if the immunity is our military source, that is weak, means all other opportunistic diseases will occur. There may be the first symptom is there may be the fever, then diarrhea, that is continuous diarrhea. Due to diarrhea, there will be dehydration. The patient will be, the signs of dehydration. You should, all of you should know the signs of dehydration also. It should be notified in the clients. And the thrush, oral thrush, that is candidiasis. The fungal, that is the fungal infection. And the skin diseases. in back, especially in back and buttocks also, and meningitis. The causative organism, the meningitis will be, it affects mainly the brain also. So all the other systems, all the systems will be affected due to the immunity, due to the less or there will be no immunity power. This is the only virus. It eats, it occupies, and it attacks our immunity system. Okay. There will be persistent generalized lymphadenopathy. There will be enlargement of the lymph nodes in the neck, in the groin, lymphatic system. Wherever the lymph nodes are there, it will be enlarged. Easy to, if you palpate, you can identify the enlargement of the lymph nodes. That is outside the inguinal area, more than 2 areas, more than 3 months also it will be there, enlargement. There will be no cure, only symptomatic treatments we can be given for the AIDS, not HIV, AIDS patients. Okay, signs and symptoms, this is the, you all know, that is related complex fever, loss of weight, anorexia, that is loss of appetite, diarrhea, okay. And nervous system will be affected, as I said, headache. Once nervous system affected means, you know, all the centers, regulation centers will be situated in our brain, okay, in the brain. So the headache, the first symptom will be the headache, severe headache. Then convulsion, fits. They are throwing the fits, continuously fits will be there. Then paralysis, stroke will be there. Then progressive dementia. The memory center also situated in the brain. So there will be dementia will be there. The permanent memory loss power will be there. Then rare opportunistic infection, then unusual malignant tumors, pneumonia. You know the pneumonia means there will be the one of the major respiratory tract disorder. The lung parenchyma will be attacked. There will be inflammation in the lung parenchyma. Pneumonia nowadays it's in winter season.
Madam, your voice is not audible.
It's more, you know.
Madam, you're not audible for some time.
Now, sir?
Now you're audible,
Sir,
yes.
yes, sir. Some calls. I'm getting many calls. That's why. So, opportunistic infection, I told you. Oral thrush, then skin lesions will be, all the system, gastrointestinal system will be affected. There will be anorexia, loss of appetite, and also there will be persistent loose motions will be there. And only symptomatic treatment we can give, but in the final stage, it's not at all used. Then there will be respiratory tract infections. That is breathlessness, it could be, or there will be pneumonia. That will be the parenchymal tissue will be, parenchyma will be affected, and there will be breathlessness or collection of more turbid secretions will be there in the alveolus. All these are pneumonia signs and symptoms will be there. Then oral thrush, he can't eat anything. These are the opportunistic, and the meningitis will be there. He will go for coma, semi-conscious or unconscious. He will be going, and the feeding. He won't take any this thing. We have to. The patient will be on IV fluids or nasogastric tube. Okay, so these are the this thing. And antibody response. This is the initial stage. HIV infection and antibody. What is antibody? What is antigen? You know, isn't it? See, antibody is the the substance generated in our own body, and antigen is the foreign body. You just imagine that the enemy countries like China, it could be Pakistan, that is the antigen, and antibody is our body. You just imagine. I'm giving an example. Okay. See, if the the antibody. Our country, military force is very weak, means the antigen, that is foreign body, that is the enemy country, will be attacking our country. So the antibody should be very strong. So we have to see that our antibodies, our immunity power should be very strong. How to maintain our immunity very strong? And see, I'm 53 years now. I'm not having any this thing, either diabetes or either hypertension, nothing, because I know how to relax the stress. I learned it, I know. So like that, you people also should know that how to maintain, say, that is called promotion of health, promotion of immunity power. See, I'm having much jewels now. I desire much more jewels. No, like that, the immunity I have, very sufficient immunity I have, because see, I'm sitting here. Many organisms are around me, but I'm not getting anything. For example, in the hospital, I'm sitting. COVID patients are there, TB patients are there, any other, all communicable disease, even non-communicable, communicable disease, many cases are there. I'm not getting that because I have very good immunity power. How you people should be maintain very good immunity power without getting any infections means, no, that is, we have to drink more waters, that is 4 to 5 liters per day, as book says, 4 to 5 liters per day. And we have to eat very nutritious and also balanced diet, not only nutritious diet, also balanced diet. And also, as you all know, all the this one bad habits like the alcoholism or smoking, it should be avoided. You people are in youths, you need some education. You should be avoid, and also you people should educate the community, the abstinence from the smoking or the alcoholism or gutta or pan parak or any other drugs inducing themselves, self-induction of drugs, everything should be avoided. So to promote our immunity health. And also yoga, very important. Yoga, it's very benefits for our body to maintain our systems, our system, physiology of our each system. And also we will be very calm and quiet in our day-to-day life. That is very important. Yoga and meditation. That is, brothers, our sisters, yoga and meditation, very important. We have to implement, we have to inculcate in our lifestyle. And also yoga, meditation and exercises. You people are very youths. Youths are, they can do the brisk walk, or you should advise the community for the this one, it depends on their age or on their disease, what kind of disease or diabetes or this thing they are having. Based on that, we have to advise the walk or exercises. Okay, for a heart patient. For heart patient, we can't tell you can go for brisk walk or cycling, like that. Okay, so this meditation, yoga, exercises, walking, very, very important. And also the rest and sleep, very, very important for the human beings. Isn't it? Whole day, you people are sitting in the college. I am doing my work, and 3 to 4 in charges I am taking here. Very, not even single minute I am not free. For lunchtime also, I am eating at 4 o'clock, 3:30 p.m. But I will balance for that. I will be balancing. I know how to balance this stress and this busiest schedule also. Like that, you have to inculcate all these factors to bring up or to promote our immunity power. And also you should educate the community, educate the public how to maintain the immunity power. And the last one, how to maintain the immunity power. One more thing is, think positively. Do not harm anything. No negative thinkings. Do think good and do good for others. Okay. This is a common manifestations. Next slide. Common manifestations. That is, as I said, these all will be there. This, as I said, thrush, everything will be there. This is a Kaposi sarcoma. Some change, this oral thrush. So candidiasis, we will give some medications for that. ulcer, mouth ulcers, that is. Okay. See, this is the final stage of HIV. Next slide, please, sir. See, this man, no, many patients I served. When I was working in the medical college, Boring, now it's a Vajpayee, this thing, Boring Hospital. I have worked many years in the AIDS ward. See, like these patients, what you are seeing in this thing, this is the final stage of HIV. HIV. See, he is very much dehydrated, and there will be loss of weight because he can't eat anything. Loose stools. He is losing all the electrolytes from the body. Okay, and emaciated. You see, he is very much emaciated, very thin. He is bedridden. He is bedridden only, but we have to follow the equality. This year theme is equality. We have to treat the same way how I am treating other patients also. And the lymphadenopathy, as I said, there will be the damage to the lymph nodes and lymphatic system also. Extreme weight loss will be there. And this is the next slide, sir. That is the pneumonia. See the chest X-ray. The chest X-ray also that shows the in chest congestion. Congestion will be there. There will be improper exchange of the carbon dioxide as well as oxygen due to there will be obstruction in the it could be in the bronchioles or in the alveoli. That is a functional unit of our respiratory. The gas exchanges takes place in the alveolus. So there will be delay or there will be more exchange of the these gases, carbon dioxide or oxygen. Next. See here that will be I will be telling it. End of this thing we have this one shows where in India where are the places where are the states, which are the states in our country, the more this one. You know, Hyderabad, Mumbai, you know, that is the red light area, it will be there. Okay, and Nagpur also, and Bangalore also. But one thing I wanted to share you people, what this one percentage was there earlier, it's declining. It's declining. The new cases are declining now because of the health workers and because of the national programs and because of the state-wise programs. We have very good programs and we are tracking the persons. We are not leaving simply. They have to come for the ART and new cases also. We are diagnosing very early and we are screening. Screening is very important. So because of creating in the awareness and also because of the dedication of the health workers, it's declining now. That is one of the happy news, but we have to stop it. We have to control, and one fine day we have to stop the new cases. And today's main part, that is the prevention of AIDS, isn't it? Once AIDS comes, once HIV positive the person has, means there will be cost effectiveness will be there, and all the anatomy and physiology will be affected of the HIV positive person, and cost, the medication cost, ART is the very, this thing, cost effective will be there, and sufferers, and the whole family will be suffering, whole community will be suffering, is not able to earn in the final stage, reaching to final stage of the HIV, is not able to earn economically also, socially also, personally also, in all the aspects he will be affecting. So prevention is better, isn't it, for other than the suffering. So anyone of any age, next slide, sir. Anyone of any age, race, sex or sexual orientation can be infected with HIV, but you are at greatest risk of HIV AIDS if you, okay. So the following points: have unprotected sex with multiple partners. All these things I have already mentioned. Then unprotected sex means having sex without using a new latex or polyurethane condom every time. See, India is the first country in producing the Nirod, isn't it? But India is the last country to use it. In our hospital, 4 to 5, 6 to 7 boxes of Nirod we are keeping every day, but it's not using any publics. That is the one sad this thing in our, so unprotected sex with multiple partners. Unprotected sex means having sex without using a new that is condom. Have unprotected sex with someone who is HIV positive. We don't know, isn't it? The person will not be knowing who is having HIV positive. Better to use the condom. That is the main. Main part of this prevention. So having safest sex with the
Madam, you're not audible now again.
knowing.
Your voice is breaking, madam.
And one thing is the unprotected sex, unsafe sex. Then second one is from the mother to baby through the umbilical amniotic fluid, it may spread. Then as I said, heterosexual and also homosexual. Through that is again, that is the unsafe sex only. And risk of occurring for men is greater of contact occurs during the menstruation. During menstruation, the coitus or intercourse should not be done. That is the main one risk. Then uncircumcised men are more likely to be seropositive and contract HIV during sex. What is uncircumcised? Means the circumcision, the foreskin of the penis. That is usually the other one religion peoples will be doing that. That foreskin will be the place where the tip of the penis, there will be the chances of the storing the causative organisms. So uncircumcised men, they are mostly likely to get seropositive and contract HIV during sex. So circumcision is the best part to avoid any kind of infections. So here the preventive part, what I should tell means safest sex, safe sex, one thing, and this one, what the blood transmission, the safe blood transmission will be there, and mother to avoid mother to child transmission of this HIV, human immunovirus, and also using unsterilized things in the hospitals, not only syringes. Syringes must, one prick, one syringe for one patient. That is must. And avoid drugs, intake of drugs, and avoid all other bad habits like smoking, then alcoholism, everything. And also the body fluids are very less, not more. Then if there is any cut wounds, children, if you are having any cut wounds, put plaster. Put plaster for that. And any other person's blood should not be get into that cut wounds. Okay, these are this thing we can be prevented. And also you should provide health education for the community regarding all these things. Main part, that is the 98, because 3 months HIV, this one, what training I have attended in NIMHANS, 98% it could be the unsafe sex. Now you know the usage of the condoms, where we should use, when you should use the condoms, when you are having sex with the unknown persons or multiple sex partners. Okay, so these are the preventive aspects. And also other than this, For the mother to baby, I told you people, if the mother is HIV positive, 100% of children will test positive at birth. And one or two exceptional also we have seen. And breastfeeding increases transmission rate. So we are encouraging them. If the mother is positive, we are encouraging the mother not to feed, and also for the artificial feeding also. During the birth, we are giving nevirapine solution, what I said. Here, by giving that, we can prevent the spread of or transmission of HIV from the mother to a child. That is soon after the birth we are giving here. Okay, see here, prevention of, there is no vaccine. We all know, isn't it? Recently we had given HVSAG, this thing, what vaccination for all our students and all the publics, and also it is included in the immunization schedule. Now the JE, Japanese encephalitis vaccine also coming. We will start this month the campaign. That is also JE campaign also. It is also will be included in the immunization schedule. But there is no HIV or AIDS vaccination. That is the main lacunae for the spread of this HIV. There is no vaccination for this, but if there is no, it can be preventable. It could be preventable. This is not through the air or water or nothing. This is not airborne disease. Airborne disease we can't prevent, isn't it? But this is we can be prevent, but we have to create awareness in the community by educating the people. Educate yourself. Educate yourself and others. That is very important. First, I should get knowledge regarding this. I should enhance the knowledge regarding this, and we have to educate others also. It could be students, or it could be patients, or it could be other publics or patient parties or other health workers. Okay, then know the HIV status of any sexual partner. That is very, very important, isn't it? See, now it better to get the HIV status and HBsAg also. It's not this one what curable. This is also only symptomatic manage if it is crosses some stages. Okay, it could be better to get the HIV reports tested before marrying. Use a new latex or that is condom, as I said. Then consider male circumcision. That is the excision of the foreskin of the penis. That is very important to prevent the lodging of the microorganisms in the foreskin, inside the foreskin or tip of the penis. Use a clean needle. This is not clean needle. It is the sterilized needle we have to use. Be cautious about blood products. That is very, very important. Blood products means it could be packed cell volume, it could be plasma, it could be whole blood. We have to know about the blood products. Then get regular screening tests. That is very, very important. We have to screen the community, and you people also get it screened periodically for the HIV. The government is providing free of cost in our hospital. We are doing it by ELISA test. Okay, it's free only, and the many tests we are. This is for pregnant women. It's mandatory. We have done. This is the routine investigation, and also for all the surgeries, all the operations also we have done it. The routine investigation, HBsAg or HCV or HIV also. And also wherever this one risk people also can be get it done. And then follow safe sex practices. Then all these things already I told you people. Then don't share needles or syringes. That is repeatedly I'm telling. Don't donate blood or organs. This is we can don't donate blood or organs. That is this thing in proper way, in systematic way, in organized manner. It could be done. Then, if the patient is HIV positive, it should not be done. Don't share razor blades or toothbrushes. That is. Then, if you are pregnant, get medical care right way. That is, we are doing it in all the Karnataka government, all India, that is central government or state government, has taken many steps. We have NGOs and we have our ART center, in that counselor will be there. We are providing counseling and mental support also. And if they are not coming for the ART, this is the not prevention, this is the prevention of AIDS, I'm telling. So we are there. If they are not coming for the ART, we are tracking them and we are calling them, and we are and NGOs also, many NGOs also working for this. And prevention is a main aspect for any disease, not only HIV, for many disease. It could be the NCD, non-communicable disease like diabetes, or this one, hypertension. These are not the disease. These are the only symptoms. Okay. To prevent everything, all the diseases, it should be, all the diseases are preventable. Everyone, each and every disease is preventable. That too, HIV, AIDS are very much preventable. Only thing, we have to know the route of transmission. That's all. And stigma. Talking about stigma. Say, today's theme is equality, isn't it? We should not discriminate the HIV or AIDS patients. We should treat them as the same like other patients also. This is offense. If we discriminate, that is the offense. That is the legal aspect. We should not discriminate any patient. We have to love them. We have to provide the quality care for them for their final stage, that is AIDS. As long as they are living, we have to provide proper love and affection, and also we have to take care of that patient as usual. What we are providing care for the others. Okay. Students, you all know there are this one, three levels, mainly three levels of prevention: primary, secondary, and tertiary. What we will do in primary? Primary means we will identify the risky groups and we will provide education. Thereby, we are preventing it. In secondary level of education, we are in the secondary level of education screening. Screening is must, and also we are screening and we are diagnosing HIV positive, and we are treating them. In tertiary, we are HIV positive is approved, and we are this one, ART, that is called ART, anti-retroviral therapy. We are giving. Why? To postpone the death or to maintain the normal counts of the CD4. So CD4 is to maintain the immunity, isn't it? That cells are very important for the to prevent any other opportunistic diseases, or to prevent the other organisms attacking in our body. So that is the tertiary level. That is main in tertiary level. The main aspect is rehabilitation. So we should educate the person. He should not move on to any other complications like meningitis. It could be, isn't it? So preventing many complications due to this HIV positive is the tertiary level of minimize the effects of ill health experienced by someone who is symptomatic with HIV disease. So these are all the three levels of preventive measures, that is primary, secondary, and tertiary. You people should know this is not only for this disease, for all the disease. These three levels are very important. In primary level, we are identifying the risk groups and providing quality education for them. And secondary, we are screening and we are confirming whether he is HIV positive or no. In tertiary, positive will be there. We are trying to avoid the other ill health or other opportunistic diseases or other complications of this disease. This is risk, next, sir, risk avoidance, risk reduction are remedies, interventions. That is nothing but ART only. For HIV patients, risk reduction means that is ART without fail. Every day he should take the ART. Now, that will again depends on the CD4 count, and every year, weekly once we are distributing the tablets. How many patients are coming? There will be huge queue will be there, and some are having TB also. Other diseases, associated diseases will be there. Our ART unit is very good, very promptly it's working, and tracking system is very this thing, and screening system also very good in our hospital. Okay. Then risk avoidance and risk reduction. This, see, risk avoidance approaches, risk, this one avoidance, abstinence, mutual, then that is monogamy. Then that is injection, safe and appropriate use of injections, as I said. Then reducing unnecessary transfusion. See, doctors here, we are not advising the blood transfusions. If the patient is severe anemic, and severe anemia means, the normal the hemoglobin level for the female is 12 to 14 grams, and for the male that is 14 to 16 grams, isn't it? If it is severe, that is below 8 or below 6, like that, means only the doctors are advising the blood transfusion. Otherwise, no. Why? Because to reduce the risk of blood transfusion. Who knows that laboratory technology has tested promptly? Nobody knows it, isn't it? So as far as possible, we are reducing the transfusion of the blood, unless it is the really indicated. Okay, next, routine HIV antibody screening interventions. Here also we are doing this. Here, risk reduction. Okay, condom, that is sexually transmitted disease. Okay, then sterile syringes. Here, abstinence, mutual monogamy, use of condoms. Then here, safe, this injection, sterile syringes. Then quality blood for transfusions, that will be there. Then pregnancy, as I said, routine checkup will be there, screening will be there. And then elective cesarean section, then breast milk replacement. What is breast milk replacement? That is that HIV positive mother should not be fed with the children. So what we will do? We will take the milk from other mothers, or from the, nowadays the bank is there. So nowadays the breast milk banks are available. The breast milk available in the banks, like that. This one, what? 8 hours, 6 to 8 hours, the breast milk will be preserved. So blood bank, like blood bank only, it will be available. And also neighboring mothers, we are getting the direct feed, or we are getting expressed milk also for the baby. That is the supplementation. See, what is the ABC approach? That is abstain, be faithful. To whom? Be faithful to the partners, your partners, sex partners, and use condoms. Abstain now. Abstain from what? We should be abstain from the this one, what? Exposures. That is again, then mutual faithfulness only. That is abstain. Okay. Not only abstain from the this one, what? Unsafe sex or unknown life, the sex partner. Abstain from the this one also, alcoholism also, drugs also, and this smoking also, tobacco, everything. Then reduce exposure, be faithful. Oh, partner, sex partners. Then block exposure effectively. That is condom use. Block exposure effectively means blockage. Means the bare with bare this thing, the person should not do any intercourse or any sex by using the condom. It's better. The rank, see, this one I have taken. This is the where our India stood in the this one, what? HIV, this thing. The South Africa will be the first, that goes first rank. Then Mozambique, that is this one. Then third, in the third place, the India is there. Then fourth place, Nigeria. So we should bring the India in the last ranking. That is our motto. How we should reduce the risk of new cases? How? By creating the awareness, by educating the people regarding the transmission, the roots of this one, causing of this HIV. Next. See, this is the patient living with HIV, PLHIV. The number of people living with HIV are estimated at around 24 lakhs. This is the August 24, 2022 census only. I have taken, usually I will go for India statistics. I never bother about the whole India, because our country is developing country, and also we should give more importance to India statistics, not any other statistics. Okay. So 24 lakhs. Southern states have the largest number of the patient living with this one HIV. That is Maharashtra, Andhra Pradesh, and Karnataka being the top 3. Okay. You have seen in the top world. Okay. Now the top 3 states in our India, that is the Maharashtra, everybody knows it, and Andhra Pradesh, second one, and Karnataka being the top 3. Annual new infection, that is ANIR, estimated 62.97 thousand in 2021 in India. 2010, 2009, it was a lakhs together. Now we reduced to 62.97. Because why? How we reduced? Because of many programs, national programs, state programs, central government programs, state government programs, that is NACO, prevention of AIDS. We are trying to prevent all the health workers. The grassroots is the ASHA workers and this ANMs. They are working very hardly in the community level, and they are bringing the patient here. Here we are sorting out and we are educating the people in the district level and also in the state level. Some NGOs are working very with dedication to bring out this 1,000 to very like 100, 200 like that. Okay, see, that is our motto. Okay, and one of this your college and this Ragini and sir has taken very good interest. Why? Because to educate the student in your level, that is the ideal age to take education like this. You people should work. You should take care yourself and also community by providing the quality education. Okay. Then maternal mortality ratio. This is today's paper where I have taken this. Deaths per lakh live births dipping over a decade. Means, say, this is not this one. This is the mortality rate. How you can read this. The number of women dying from pregnant related issues in India. This is declined now, isn't it? This is also one of the how we reduced mortality rate. That is MMR. How? This is not due to AIDS or this thing. How we reduced means because the ASHA workers, the ANMs, and the nursing fraternity and the other health workers, they are working constantly. They are working with motivation. And they are motivated. The government is motivating and giving incentives also for this. So like this only we have to change. We have to reduce the this one, what HIV new cases also. So now I think Manoj sir, I think its time is up now.
Yes, madam. Yes, madam.
Yeah. Okay. Any one day I can take again, because I am a nursing superintendent here. Now many calls are coming for me, yes. And our DS also calling me. I have taken only 1 hour permission with my madam. If any doubts also, I can 1 or 2 doubts I can clear. Otherwise, one day afternoon I can take one more session.
All right, ma'am.
Okay,
Can you
sir.
hear me now? Can you hear me, ma'am?
Yes, definitely. I'm hearing you,
Perfect.
sir.
Okay, perfect. Thank you so much, ma'am, for that insightful presentation. And this
Okay.
presentation was an effort on this World's AIDS Day to create an awareness about different aspects of
Yes,
AIDS and
definitely.
prevention of AIDS. So I especially thank you so much, ma'am, for this insightful presentation and for you coming here in such a short notice. You know, we just discussed yesterday evening and we requested you to be here and you agreed, and that was so much. We are really thankful for you for that gesture of yours, ma'am. And I thank Patel Group of Institutions Ramnagar for taking this effort to create awareness to the students. And thank you so much, ma'am. And definitely we'll connect. Just a brief introduction about ma'am. Ma'am comes with more than 20 years of experience in core clinical settings of ICU, dialysis, NICU, OT, and she was working at NIMHANS also. She has worked as an assistant professor at Government College of Nursing, BMCRI, and as a principal of for NM and LHV Training Center. She is a program coordinator for paramedical courses and nursing superintendent. She worked during the COVID times tirelessly, and she achieved this Sarvothama Award for COVID management. So that was something great achievement for Madam, and she has been doing a lot of awareness campaigns for creating awareness to the students and helping them understand different disease management and during the clinical setting. So thank you so much, ma'am, for your time.
And one more thing, sir.
Yes,
yesterday from your college, we have received 7-8 students.
Yeah,
that food poisoning. Till 8 o'clock, I was here only, sir, yesterday.
Yeah.
By treating your college students only.
Yes, ma'am. That is so kind of you, ma'am.
My sincere, sir, students are hearing.
Students are definitely there, ma'am. Definitely.
Okay,